Hi there. My name is Brian Porter. I'm a general cardiologist here at Core Physicians at Exeter Hospital. It's a pleasure to meet you. I'll be talking to you today about some of the cardiac devices that we use to help take care of patients' hearts here at the hospital. Now, as you probably know, the heart is a mechanical pump that squeezes rhythmically. And every second or so, across the entirety of your life, the heart squeezes out a little bit of blood every second. And the heart knows how often to beat because it has its own internal electrical system. And that internal electrical system is, in general, extremely reliable. It works for 70, 80, 90 plus years in some cases without any flaws at all. But every once in a while, that electrical system of the heart may run into some trouble. And that's when it may be useful to see either myself or one of my colleagues here at Exeter Hospital at Core Physicians. So when your heart runs into some electrical trouble, or if your cardiologist thinks there might be something wrong with the heart's electrical system, you may be asked to undergo one of a series of different tests that we use to try to understand what's wrong. And I just wanted to run through some of those tests with you today. The first test that I wanted to mention briefly is something called an EKG, or also known as an ECG for short. You may be familiar with this already. It's a very common test that's done both in cardiology offices as well as family practice and internal medicine offices. And that's simply a 10-second snapshot of the heart's electrical system. In a test like that, you just lay on a bed. There's a series of stickers that are put on your body, and a map of the heart's electrical system is created. And that's very useful for folks like myself to try to understand what might be wrong with the heart's electrical system. It's a very good test, but it really only captures about 10 seconds of time. So for patients who are having infrequent symptoms, we may recommend a slightly different test related to an EKG, which is a patch monitor. And a patch monitor looks like this little sample that I have right here. The patch monitor, it's a little bit bigger than a credit card, and it sticks right on your skin, right over the heart, like this. The patch monitor can be worn for up to 14 days. Believe it or not, it's waterproof. Inside of this is a chip that's sort of very inert and can't be damaged by any activities that you do or showering. And you wear that monitor for up to 14 days, and it can save information about every single heartbeat that you have during those 14 days. So for someone who is having infrequent symptoms, such as a feeling that their heart is racing or a feeling that their beats are skipping or somewhat out of sequence, that patch monitor can be a very useful bit of information for you and your cardiologist. So if you've worn the Zio patch for a couple of weeks and it hasn't picked up any electrical system issues with your heart, but you're still having problems such as erratic heartbeats or infrequent episodes of fainting, your cardiologist may recommend implantation of a tiny little device called an implantable loop recorder, or ILR for short. The implantable loop recorder does a lot of the same things as this patch monitor, but it's much smaller. And it's actually injected under the skin as a sterile procedure. Believe it or not, this little device has a battery that will last 2 to 3 years. And for someone who's having very infrequent symptoms of either lightheadedness or fainting, or even someone who's having strokes for unexplained reasons, we will often recommend implantation of an implantable loop recorder. And that procedure is essentially something that we do as an outpatient walk-in procedure. So a patient will come into the hospital, we will bring them to our procedure area, we clean the skin very thoroughly, and then this little device is injected with a syringe right under the skin. We use numbing medicine, and it's injected right under the skin, not too deep, in the left chest area, right overlying the heart. And this device can detect all of your heartbeats for up to 2 to 3 years. We also have the ability to monitor this device in our clinic. We have a full-time registered nurse whose job it is to analyze the signals that are being sent from these implantable loop recorders and from our pacemakers that I'll talk to you about next. If we ever sense something, if the loop recorder ever senses that the patient's heart rate is not quite right, then we'll be able to take action based on that information. So again, for someone who's having symptoms that are very infrequent and can't be detected on a Zio patch like this, sometimes we'll insert a loop recorder under the skin. So moving on, I wanted to talk to you a little bit about what might happen if you're having fainting spells. So for folks who are having fainting spells, oftentimes that can be due to the fact that the heart's electrical system is not beating in a reliable way. Now, fainting spells can be very infrequent. For example, they might happen every 3 months or a couple of times a year. If we're able to determine that someone's heart is not beating in a safe, reliable way, or for patients whose heart rates are too slow, we will often recommend implantation of a cardiac pacemaker. Now, I have some examples of cardiac pacemakers here in front of me. A cardiac pacemaker is about the size of an Oreo cookie, so it's even a little bit smaller than that Zio patch. The cardiac pacemaker is implanted under your skin, usually in the left upper chest area or sometimes in the right upper chest area, generally in the area where your chest pocket would be. So I have a chest pocket on my coat. The pacemaker fits under the skin just like this, and it's stitched in place. Once it's installed, you can't really see it. You can sometimes feel it, but it's hidden under the skin. The cardiac pacemaker has a special wire that runs down inside your body from the pacemaker down to your heart. And that's how the pacemaker knows what is going on with your heartbeat. And for someone whose heart rate is too slow or whose heart's electrical system is beating unreliably, the pacemaker can detect that through this wire. And then it can also the pacemaker can deliver a pulse down to the heart to tell the heart to start beating again. So this is a very useful procedure that we will offer to patients whose hearts are beating too slowly or whose hearts are beating in an unreliable way, potentially causing them to faint or to feel badly because of a low heartbeat. And pacemakers come in all different shapes and sizes. There's a number of different companies, but in general, they're all pretty small devices that fit in the upper chest area. So in the course of your workup, you and your cardiologist may determine that rather than having a heartbeat that's too slow, you have a heartbeat that's too fast. And that could be a tricky problem to solve, but we can generally solve it either with medications or certain medical procedures. One of those medical procedures that I wanted to talk about today is the insertion of something called an ICD, which stands for Implantable Cardioverter Defibrillator. And a cardioverter defibrillator is something that you might have seen on television, in movies, where a patient is on the gurney and not doing very well, and the doctor will come up to them with paddles and then give them an electric shock. An implantable cardioverter defibrillator does much the same thing, but with a small device that looks just like this, that's implanted under the skin. Most patients with heart disease do not need one of these devices, but sometimes they do. Patients who are at very high risk for sudden cardiac death may be recommended to have implantation of an ICD. So the ICD is a little bit bigger than a pacemaker, shown here for comparison, but it's inserted in much the same way through an incision in the left or right upper chest area. The device is inserted into a little pocket that's made under the skin, and the skin is then stitched up with dissolvable stitches. So once it's installed, there may be a little bit of a lump that you can feel, but it's really not something that will ever poke out or show. And so it's inserted under the skin. It works completely automatically through a wire that is, again, inserted under the skin and connects the brains and the battery pack to the heart. Now, if the device senses through this wire that the heart is beating too quickly, the device can send an electrical impulse or series of electrical impulses down to the heart to restore normal function of that heart and save a person's life. So again, most patients don't need these, but some patients do. And this is a procedure that we can do here at Exeter Hospital if you need it in order to help you live a nice, long, safe, healthy life. So in summary, I've talked about a few of the different electrical devices and electrical testing that we can offer patients here at Exeter Hospital to treat heart disease. We talked about the patch monitor, which can be used to assess for any electrical problems that you might be having on a short-term basis. We also talked about the implantable loop recorder that can be inserted under the skin to look for longer-term rhythm problems with a patient. We also talked about implantation of a pacemaker, which is very helpful if someone's heart is beating too slowly. And if someone's heart is beating so rapidly that they're at risk for a lethal arrhythmia, We will even sometimes offer an implantable cardioverter defibrillator. There are a few other tests that we sometimes may recommend to you, and your cardiologist can talk about that in more detail when you come in for your visit. Now, Dr. Podrasky and myself are two of the doctors who implant these devices. We are available to see patients almost every day of the week, and we look forward to meeting you.